This training video is a supplement to Section 8 in your policy care manual that we've developed for you. First of all, it's important to note that patient care items are classified into three areas: those that are critical, those that are semi-critical, and those that are non-critical. Critical items are the items that touch the bone and the blood of the patient. They penetrate soft tissue as well. These items have the greatest risk of transferring a disease and infection, and they must be sterilized by heat. Some examples of critical care items that you will use while dealing with the patient could be the scaler, which is going to penetrate soft tissue, will be in contact with blood and possibly bone. You have the blade and the scalpel, which holds the blade, and for purposes of not having to open I'm just demonstrating that it is inside the package. But this would touch bone, this would involve bleeding and the tissue, cutting tissue, gum line, so that would be a critical item that needs to be heat sterilized. You have the bone file, which is used to file the bone, portions of the bone during perhaps an oral surgery procedure. This would be contaminated with blood, bone, and tissue. It would need to be heat sterilized. You have your burrs, which when used to enter into the tooth or during a surgery will most definitely involve blood, bone, and tissue. And then you also have some forceps, which I'm using this pair. I don't have the exact pair that I would like, but the forceps used for oral surgery, perhaps getting some of the tissue that's been cut away for a biopsy, maybe that's used for that purpose, and that would involve blood, bone, and tissue as well. Now we're going to move on to the semi-critical items. Again, semi-critical items are those that touch the mucous membrane or the non-intact skin without broken areas, and they have a lower risk of transmission. Most semi-critical items in dentistry are heat tolerant and should be heat sterilized. But if the items will be damaged by heat, the alternative would be at a minimum, a high-level disinfectant. Examples of semi-critical